Hello, I'm James Kleinberg, and this is my speech of definition. The topic is going to be cardiac arrest, and if you live in America, chances are you will probably die from cardiac arrest or some other heart-related disease. Cardiac arrest is the leading cause of death in adults over 40 in the United States. This comes from the website www.sca-aware.org/about-SCA. This was last updated 12/18/2013. People who experience cardiac arrest outside of the hospital, 1 out of every 10 live. So that means 10 people have cardiac arrest, 9 people die, 1 person lives. Some questions I'm going to answer are going to be, what is cardiac arrest? What can be done if somebody is experiencing cardiac arrest? And also, what can hospitals do to also help prolong these lives? Cardiac arrest is real and it's scary, but with the proper precautions and proper care, you just might make it alive. Cardiac arrest is an arrhythmia. Arrhythmia is an irregular heartbeat. This causes the blood to not pump effectively throughout the body, which can lead to serious problems like death. Thickening of the heart muscle can lead to cardiac arrest and also other arrhythmias, such as QT syndrome, and can place a person at a higher risk of experiencing sudden cardiac arrest. Some risk factors for cardiac arrest include previous heart attacks, previous cardiac arrest, previous cardiac arrest, high cholesterol, heart failure, blood vessel abnormalities, and decreased heart function. Now that we talked a little bit about cardiac arrest and what it is and how it happens, we can start talking about the treatment. If somebody experiences cardiac arrest, only about 1/3 or 32% of those people receive CPR from bystanders. And of that 32%, only 2% use an AED, which is going to be an automated external defibrillator. And I got that information from a handout on arrhythmia. The AED is a machine that's small and portable, and you open it up, and basically it's a heart kit. What you do is you take the probes, which are like little stickers, and you put them on the chest of a patient, and you turn the machine on, and the machine checks for any abnormalities, and it can pretty much detect if there is an arrhythmia or not, and it can recommend whether to shock or not. Always remember, when it is in shock mode, to stay away from the person being shocked, so you do not get shocked yourself. A lot of those people, the 2%, a lot of those people who give care and do not have AEDs, it's because it's not readily available to everybody. It is it is $1,500 to $2,000 to buy, and you also need a prescription from a doctor to buy it. So the best thing you can do if somebody has cardiac arrest is to start CPR immediately. Also call 911, have EMS en route, and grab an AED if possible. If you do have an AED, it's also important to let the EMS know, or the emergency services know that you've used it. If that immediate action was not able to save the person, there's always the hospital. At the hospital, patients can be resuscitated, and a mild therapeutic hypothermia may improve chances of survival. Also, an ICD, or implantable cardioverter defibrillator, is able to be used. Basically, that's placed inside of the individual, and it works as an AED basically. It detects arrhythmias, and it can give a life-saving shock if needed. I got that information from this brochure, which I got from Mercy Medical Center. It was printed by Cranes, the MIDI Media USA company. So, in conclusion, cardiac arrest is real and it's scary, but with the proper precautions and care, you may make it out alive. During the course of the speech, I hope that you learned what an arrhythmia is. Basically, that's an irregular heartbeat that can cause major problems throughout the body. When somebody experiences cardiac arrest, the things you want to do is initiate CPR and also use an AED if available. Usually within the first 3 to 5 minutes is recommended after a person collapses or experiences a cardiac arrest. Also, an AED can't really hurt the person, as the only time you would use it is if their heart is not beating and they're actually dead. Hospitals can use a therapeutic hypothermia to resuscitate, or excuse me, to make the patient recover a little bit faster and improve brain function. The use of an ICD can also be used by the hospital as an AED and a way to track the heartbeats. Are you ready to save a life?
I stayed quiet?
Yes, you were very quiet. Good job. You rock.